Hello, my name is Dr. Dewan S. Raja. Today I will discuss about the anatomy of the gluteal region. This is the gluteal region. The gluteal region lies posterolateral to the bony pelvis and proximal end of the femur. The gluteal region communicates anteromedially with the pelvic cavity and the perineum through the greater sciatic foramen and lesser sciatic foramen. Inferiorly, it is continuous with the back of the thigh. This is the thigh area. The skin of the gluteal region is innervated by the cluneal nerve, the cutaneous innervation. Around the iliac crest, we'll get the superior cluneal nerve, L1 to L3. Middle part, the cluneal nerves are derived from the sacral plexus S1, S2, S3. Inferior cluneal area, the inferior part of the gluteal region, getting cutaneous innervation by inferior cluneal nerve. Those are derived from the posterior cutaneous nerve of the thigh, mostly by S2, S3, maybe from S1 also. Okay. So muscles of the gluteal region is important to us. We have many muscles. Gluteus maximus muscle. Gluteus maximus should take origin from here, behind the posterior gluteal line. This is the posterior gluteal line. It also takes origin from the sacrotibial ligament. This is the sacrotibial ligament. Okay, and it inserts to the iliotibial tract as well as to the gluteal tuberosity of the femur, with the gluteus medius muscle that takes origin between the anterior gluteal line and posterior gluteal line. Okay, there is the gluteus medius. Insert on the greater trochanter. Gluteus minimus, okay, that is taking origin between the inferior gluteal line and the anterior gluteal line. Okay, then the piriformis muscle. Piriformis muscle should take origin from the sacrum, coming out through the greater sciatic foramen. This is the greater sciatic foramen. Okay, and it will occupy most of the part of the greater sciatic foramen area. Okay, then obturator internus. Here is the obturator internus muscle origin. Obturator internus and gemellus superior, gemellus inferior, they occupy the inferior sciatic foramen area here. This is the inferior sciatic foramen. This is the sacrospinous ligament, sacrotibial ligament, and this area is the inferior sciatic foramen. These are occupied by the gemellus superior, gemellus inferior, most of the part. We have the quadratus femoris muscle. Quadratus femoris, this is the quadratus femoris here, origin here, insertion here. Tensor fascia lata. Tensor fascia lata is taking origin from here, from the outer lip of the iliac crest on the anterior aspect. Okay, so this is tensor fascia lata that will be inserted to the, mostly to the, it will insert it to the iliotibial tract. Okay, we have to remember that muscles in the gluteal region are mainly abductor, extend, laterally rotate the femur, and some of them stabilize the hip joint. Okay, so they abduct, extend, laterally rotate the femur relative to the pelvic bone. So these are the action of the muscle. Tensor fascia lata stabilizes the hip joint. Okay, we got that. Now go to the next slide here. Muscles of the gluteal region. Okay, muscles of the gluteal region. We go there. Here is the muscles of the gluteal region. Okay, here we have the superficial muscle, deep muscle. Superficially we have the gluteus maximus muscle, gluteus medius muscle, okay, and underneath the gluteus medius we get the gluteus minimus muscle, the gluteus minimus muscle, and with the deep muscle like the piriformis, the gemellus superior, the obturator internus, gemellus inferior, quadratus femoris muscle. Okay, these are the muscle. We must know their nerve supply. Gluteus maximus, nerve supplied by the inferior gluteal nerve. Gluteus medius, minimus, innervated by the superior gluteal nerve. Okay, piriformis getting innervation from S1, S2. Gemellus superior and the obturator internus innervated by the nerve to the obturator internus. Gemellus inferior, quadratus femoris, is getting innervation from the nerve to the quadratus femoris. Okay, so here is the gluteus maximus muscle. Most of the fiber insert to the iliotibial tract. This is the iliotibial tract. This is the thickening of the fascia lata, extending from the iliac crest around the tubercle of the iliac crest here, going here to the tibia, to the gardis tubercle of the tibia. Okay, this is the iliotibial tract. It also receives the tensor fascia lata muscle. So tensor fascia lata inserts to the iliotibial tract. Most of the fiber of gluteus maximus inserts to the iliotibial tract. The gluteus maximus also inserts to the gluteal tuberosity. We'll go there, gluteal tuberosity area. Okay, so we got the gluteus maximus is the chief extensor of the hip joint. Chief extensor of the hip joint. Gluteus medius minimus, they are mostly abductor and support the other side of the pelvis. Okay, we got that. Now we go to the next slide. Structure passing through the greater sciatic foramen. Okay, this area is the greater sciatic foramen, and what structure passes through it? Some structure passes above the piriformis muscle. Most of the structure passes below the piriformis muscle. Above the piriformis muscle, we have the superior gluteal nerve and superior gluteal vessel. Okay, root values L4S1. Structure passing below the piriformis, this is the piriformis muscle. A lot of structure passes below the piriformis, that is the inferior gluteal nerve. We'll get inferior gluteal nerve and we'll get the inferior gluteal vessels here. We have the inferior gluteal vessels. The sciatic nerve, the largest nerve of our body, very thick, almost like that of our index finger. Okay, so posterior cutaneous nerve of the thigh. Here we'll get posterior cutaneous nerve of the thigh. Okay, we'll get the posterior cutaneous nerve of the thigh here. Then nerve to the quadratus femoris. This is the quadratus femoris. So it is getting nerve to the quadratus femoris. Then pudendal nerve. Pudendal nerve is coming out through the greater sciatic foramen. Then it turn around the ischial spine and enter inside the lesser sciatic foramen, going to the pudendal canal along with the nerve to the obturator internus. Okay, pudendal nerve. We have also structure below that. We must add the internal pudendal artery here. We'll add internal pudendal artery. Okay, here pudendal nerve and internal pudendal artery. Okay, internal pudendal vessel, nerve to the obturator internus. Okay, we got the nerve to the obturator internus here. Okay, this structure, this 1, 2, 3 structure, they come out through the greater sciatic foramen, below the piriformis. After a short course in the gluteal region around the ischial spine, again go inside the pelvis to the lesser sciatic foramen. These three structures. Structure passing through the lesser sciatic foramen